Our patient today is Lego, a 26-year-old quarter pony who presents with no symptoms. Today, we are giving him a routine 5 milliliter injection of Adequan intramuscularly to help manage arthritis and joint pain. Before giving the injection, we need to prepare the area. Because the injection is intramuscular, the entire area does not need to be sterile. Only the seal of the Adequan, the needle, and the area of the neck where the needle will be inserted have to be sterile. In this area, we have all of the items necessary to give this injection. In the small tray, we have the Adequan, the syringe, and the needle. Next to it is a sharps bucket for disposal of the syringe and needle after use, and a container of alcohol cotton swabs to sterilize the horse's neck. After all of the materials are ready, we can begin the process of giving the injection. The vet tech will begin by securing the needle onto the syringe, leaving the cap on to make sure it stays sterilized. She will then break the seal on the syringe by moving the plunger back and forth a couple of times. The next step would be to drop the medication. Before doing this, the vet tech needs to remove the cap over the needle. As well, since this bottle of Adequan is new, there is still a cap on the bottle. She will remove this next and use the needle to break the seal on the new bottle.
After this, the vet technician can draw up the medication. As you can see, she is holding the medication above the needle and syringe to ensure the needle is pushed deeply into the bottle and to ensure she's not drawing any air. She will then carefully remove the needle and syringe from the bottle, making sure to not contaminate the needle by letting her fingers touch it or any other unsterile foreign material. To finish preparing the medication for intramuscular injection, she will put the cap on the needle to, again, preserve sterilization. To prepare the injection site, the veterinarian would first need to determine the correct location for the injection. Right now, she is running her hand along, first, the cervical vertebrae, followed by the crest of the neck, and then she will put her hand along the shoulder blade. This creates a triangle where the injection can be performed. She will then lay her hand down flat, and the point where her fingertips touch is where the injection should go.
Next, the vet assistant would hand her the container with the alcohol cotton swabs. Using 1 or 2 cotton swabs, she will sterilize the area where the injection is going to be given. As you can see, the veterinarian does not just do a small area, but rather a large area to make sure that there is less risk of non-sterilization and possible infection. After letting this dry for a moment, she will take the syringe and needle and remove the needle cap. Before inserting the needle, she will pinch a fold of skin directly above the neck of the injection site. This will help with pain management for horses that are sensitive or startled. She will then insert the needle almost perpendicularly to the neck and into the muscle. It is very important to insert the needle all the way to the hub. Before injecting, she pulls back on the plunger. As you can see, no blood enters the syringe, which means that the needle is in the muscle and not a vein or artery. If it were in a vein or artery and the medication was injected, this could be deadly for the horse. After making sure the needle is in the muscle, she slowly pushes the plunger until the syringe is completely empty, and then slowly pulls out the needle and syringe. She will then put the needle cap back onto the needle for safety. Finally, the used and no longer sterile syringe and needle will need to be put into a sharps container where it will be later safely disposed.